One that I've really used quite frequently in my practice is called Orthoprophy. It's basically a soft alumina, so it's not quite like the aluminum oxide. It's a little lesser debris. And the nice thing I like about this is I can use this for a lot of different things. But one of my favorite things is I try to get my orthodontists to use this as well, because when they take off those brackets, and you know how we have a lot of residual cement and those type of things, and they go back in and they do a nice job. They try their best, I should say. But sometimes they'll leave that cement and that debris on the tooth structure, and they go in and they'll take a fine diamond or a carbide or whatever, and they'll try to smooth that off. And that works fine and dandy, but generally what you're going to see is you see a lot of nicking of the enamel structure, and you'll see that dull appearance when your patient comes back, and you'll see lines and you'll see some new grooves and whatnot. What the Orthoprophy does is really well is it removes at a level only to the point of taking off what needs to be without damaging any of the enamel. So you can use that in a lot of ways. You can use that for, like I said, removing the orthodontic resin. You can use it to remove pit and fissure, old resins prior to bonding. You want to get rid of an old sealant. You can use it on prior to bonding a Emax restoration on tooth number 4, for instance. I'll use that sometimes over an aluminum oxide if I'm concerned about over abrading or potentially damaging some of my margins. So it's a nice adjunct, probably an underused adjunct that's not used a lot or even talked about a lot, but it's really got a lot of true benefits to what it can do. And the underlying thing for me is basically without damaging enamel. That's one of the things we always try to do is protect our teeth, and the least things we can do to these teeth, the better. Okay. Now, so overall applications, either way you go, we've talked about this a little bit, but obviously conservative cavity preparations. Our goal, or my goal, is to use this without anesthetic. Okay, so a lot of my practice is built on using the PrepStart H2O. I use it on a daily basis, whether that 1 or 2 or 3 times. But really the nice part about it is I can do that in a quick multiple quadrant section and get a lot of dental work done in a short period of time. Do I use anesthetic in some situations? Absolutely. If I do use anesthetic, I generally don't start with my PrepStart H2O. I will start with the burr, open that up, and generally I will finish with my PrepStart H2O and take any of the residual decay out, and also begin the microetching, the roughening up process of my enamel margins. So that's one thing I like to do. Obviously, we talked about that. Big thing in a lot of practices today are ceramic restorations, and we should be definitely cleaning our preparations prior to cementation, and really no better way to do that than microetching. Okay, we'll talk a little bit about some introduction of some silica, non-silica to bonding protocols when we talk about bonding of zirconia restorations. We should be having these on hand for intraoral repairs. We obviously do a ton of ceramics in today's world. Obviously, a nice adjunct would be for something, and we'll talk about that shortly as well, about how can I repair porcelain that's damaged or chipped in a restoration that has extremely sound margins. Those type of things. Okay, so these are some of the applications that we talk about when we look at that. But overall, the main thing we're known for when we talk about microetching or air abrasion is the overall ability to improve bond strength. Studies have shown, definitely in comparison to a diamond burr or any type of sandpaper medium, microetching definitely increases bonding by approximately up to 400% by overall just increasing that surface area. Can increase surface area far better than any type of diamond burr or any other medium in that neighborhood.